Anita ma'am, please go ahead.
Sure, ma'am. Can I start?
Yes, ma'am.
Okay. Thank you. Good evening, everyone. We would like to wholeheartedly welcome each one of you for the therapy for the therapist session. And today, it will be the 102nd session. The topic for today's session is holistic health of adolescents. And this is being organized by the Deccan Positive Mental Health team, which has Manasa Shubhakara Mindcare Hyderabad, Yellow Pond Counseling Center India, Forest Creative Arts Studio Punjab, Sri Deepthi Counseling Center Hyderabad, Global Learning Center Hyderabad, Shisha Counseling Center Kozhikode, and Mindstyle Hub of Kolkata. Our honorable resource person for today is Dr. Abha Ketirpal. We would like to welcome you, ma'am. Her
Thank,
designation is she is a retired officiating principal and associate professor, DAV College for Girls, Yamunanagar, Haryana. Ma'am retired on September 30th, 2022 as an officiating principal. Her qualification as she has a BSc, HSc, gold medalist, MSc Food and Nutrition, PhD Food and Nutrition. Ma'am has a rich experience of 35 years and she has organized several national level seminars and acted as a resource person in conferences related to adolescents and women's health. Member of several professional bodies related to nutrition like IDA, ISPEN, and SI. With that very, very short introduction, we would like to welcome you once again. Very honored to have you here. And the floor is yours. Over to you, ma'am. Thank
thank
you
you
so
so.
much once again for being
Thank you,
here.
ma'am. You have a lovely voice. Thank you for the wonderful introduction. I recognize few faces. Sir is there, then Anjali is there. But I am new to this particular platform, so I hope you will enjoy the session and let it be an interactive session. In case you have any queries, anything to share, we can do that after the session. Now, moving on, I'll be dealing with holistic health of adolescents. That is the need of the hour. Now, health, as we all know, refers to a state of physical, social, mental, and emotional well being. And it's not merely a state of absence of disease or illness. It means that you are physically, mentally, socially, and emotionally well. This is what is known as holistic health. So, health can be divided into four parameters: mental, physical, social, and emotional. Mental health is the state of well being when a person is able to be productive, is able to contribute to his community, and along with that, the person is able to cope with the daily stresses of life. That is mental health. Sound mental health. Physical health is when a person is free from illness, injury, and he or she follows a physical fitness routine, whether it is exercise or yoga or meditation or simple walking or running, taking a nutritious diet and observing hygiene and has good lifestyle and good habits. A sound social health is when the person is able to interact, or when the adolescent is able to interact very well with other persons in the society, be it be in the family, the peer group, the guardians, the teachers, and is not only able to interact, but is also able to contribute to the society and is able to collaborate, communicate, and has satisfying personal relationships. And a sound emotional health is when the adolescent is able to control and manage and, of course, express emotions comfortably as and when required in the intensity it is required. Adolescent health is very, very important and the need of the hour. किशोरावस्था बहुत एक तनाव युक्त period होता है, and adolescence is derived from the Latin word adolescer, which means to grow. Now the child is growing up, which means to grow, to mature. It is a period of change, a period of transition from childhood to adulthood. The adolescents are no longer children, yet they are not adults. And this period is characterized by rapid physical growth, significant physical, emotional, psychological, and spiritual changes. They suffer from various problems, and their problems are multidimensional, and hence they require a holistic approach. Adolescents are not only in large numbers, but they are the future citizens and the future workers of tomorrow. A large number of adolescents, however, in India, they're out of school, they are malnourished, they get married early, they are working in vulnerable situations and are sexually active, and they are exposed to tobacco and drugs and are not guided properly. Adolescence falls between the age of 10 to 19 years. Now, early adolescence is 10 to 13 years. Then is the middle adolescence, 14 to 16 years. And then late adolescence, 17 to 19 years. So, youth comes between 15 to 24 years, and a young person is falls between the age group of 10 to 24 years. So early adolescence, that is, I just said, is between 10 to 13 years. One can see spurt of growth and of development of secondary sex, both in girls and boys. Middle adolescence, that is 14 to 16 years, then now the adolescent wants a separate identity from the parents. He discovers new relationship, gives more importance to peer group, wants, has a desire for experimentation, is more interested in opposite sex, and grows up. Late adolescence, that is 17 to 19 years, the adolescent has a distinct identity, has well formed opinions and ideas, and wants to take his own decisions and wants to gather information. Several changes are taking place during the adolescent period. These are biological, cognitive, social, and emotional changes. Biological changes is the onset of puberty in girls and boys, and secondary characters are clearly visible, and you can differentiate a girl from a boy. Emotional changes are the adolescent is conscious of the self image, develops the feeling of intimacy, develops relations with peer group and adults. Social changes, the adolescent now wants to be a part of the society. He transits into new roles in the society and wants to collaborate and communicate and get importance in the society. Cognitive changes, there is emergence of more advanced cognitive abilities. The adolescent is able to decide fast, is able to think for himself. Challenges in adolescent development and health in India. There are few. These are the results of a survey which were conducted. It was found that 45% of adolescent girls and 20% of adolescent boys are undernourished. Early marriage exists in girls is the percentage is 26%, and in boys it is 54%. 20 to 30% adolescent boys and 10% adolescent girls are sexually active. However, 59% adolescents know about condoms, and 49% adolescents know about contraceptives and other safety measures. 4.5% are taking drugs or alcohol. Adolescent abortions is 1 in 4.4 millions, and 50% of all HIV positive new infections are in the age group of 10 to 25 years. Adolescents are a diverse population group. We call them a diverse population group because they have different needs, and their needs are changing as they move from childhood through adolescence into adulthood. So they must have good health, must have holistic health, means they should be physically, mentally, socially, and emotionally in good health as they are now growing up, and it is a diverse population. Adolescents need information and skills because they are still developing. They're moving on from childhood to adulthood. So they need information, they need skills, they need a safe and supportive environment because they are now in an adult world, and they are growing up, making their own identity, gathering information. They need health and counseling services so that they are safe. If they have any problems, they should have an eye, I'm sorry, they should have an ear where they can relate, where they can discuss their, or they can have their queries solved. So adolescents need information and skills, health and counseling services, safe and supportive environment, because we want them to develop physically, mentally, socially, and emotionally. Now, impact of adolescence can be seen. There is lack of formal or informal education in adolescents. They are now transiting from dependence to relative independence, which poses some problems for them. They are becoming sexually mature, and there is onset of sexual activity. They require safe and supportive environment because there is a desire for experimentation. There is a problem of school dropout, childhood labor, malnutrition, anemia or deficiency of iron and B12, early marriage, teenage pregnancies. Their habits and behaviors which they pick up now will have lifelong impact, especially the wrong habits, that is alcohol, tobacco, or smoking. Lot of needs regarding nutrition, reproductive health, and mental health are unmet. So, right now, they require a safe and supportive environment so that they can grow in a healthy way. They are ignorant about sex and sexuality, so they require some information. There is lack of understanding, so they require family support. There is suboptimal support at family level. The family must understand that the adolescents are growing up and they require full support at this level. There is social frustration, inadequate school syllabus about adolescent and reproductive health, misdirected peer pressure in the absence of adequate knowledge, and there is lack of working opportunity, lack of creativity, and lack of recreation, which again leads to frustration among this group. Adolescents suffers from various health problems. That is, anorexia nervosa means the child is not able to eat properly. There is obesity, overweight because more fast food intake is there, wrong lifestyle patterns are there, no exercise is there, internet addiction is there, which leads to obesity and overweight. Adolescent pregnancy is there, micronutrient deficiencies are there, emotional problems, behavioral problems, there is substance abuse, sexually transmitted infection occurs. They have identity problems because they are growing up. They are neither a child nor an adult. They have thinking and studying problems also. So, adolescent faces several problems and needs guidance by the parents, by the teachers, by friends, by community, by the society as a whole. Reasons for adolescents reluctant to seek help is because they are afraid. Fear is there. They are uncomfortable with the health worker who questions them because they think there is no privacy. There is lack of privacy, there is lack of confidentiality. It's a very big cumbersome procedure to fill in forms and then discuss with the health worker. That is why an adolescent is reluctant to seek help from health centers. He or she feels discomfort. There is lack of information. Parental consent has to be taken. There is long waiting line time or a long queue is there, and there are many operational barriers. That is why, because of these reasons, adolescent is reluctant to seek help. Adolescent is in crisis. We must understand this. There are several issues which the adolescent faces in today's society, which can bring about anxiety, depression, presents various challenging problems. An adolescent might not be able to take proper decisions or might face difficulty in decision making. However, these crises or these problems vary from person to person. An adolescent may behave or deal differently with these problems. However, some may become depressive or may face problems. However, some may take these in their stride. So it varies from adolescent to adolescent how they deal with the crisis. Internet addiction is there, spending a lot of time online or on the computer. It acts as an impulse control problem as it absorbs too much of the time, and they neglect their relationships, their work, their school, or other important things, and may also suffer from anxiety, depression, and may go on to taking drugs, alcohol, gambling. They will not have social support. They may become an unhappy teenager. They may be less mobile. Their lifestyle is not good. They may suffer from obesity, overweight, and this addiction becomes very unpleasant and develops overwhelming feelings in them, and it is a risk for them. Substance abuse, some young people or adolescents, they use drugs including nicotine and uh, alcohol because they feel that they change how they feel, because they want to feel better or different. They might be able to relax more when they're using drugs or alcohol. Out of curiosity they might use, when they're socializing with friends, peer pressure, or the need to feel part of the group, to escape from certain physical or from psychological pain, they might start taking drugs. Adolescents are particularly susceptible to substance abuse because their brain is not developed fully, and their cognitive thinking is also still developing. They are still developing the skills which is needed to make wise and good judgments, needed to make good decisions, to have self control. They become risk takers. However, they do not understand that in order that if they take too much of drugs and nicotine or alcohol, it might lead to excessive stimulation, which is bad for them. Drug abuse means they start using drugs which are even prescribed, or the prescribed medications, or certain household substances. These drugs, directly or indirectly, they cause a pleasurable increase in the amount of dopamine in their brain, and the brain adapts to this drug induced surges in dopamine by producing less dopamine naturally. So this decrease in the naturally produced dopamine compels the addicted person to keep taking drugs, because he wants to bring the dopamine function back to normal. But now he doesn't know that larger amounts of drugs are required to achieve the same effect, because he's not tolerant to the low amount of drugs he takes. Alcohol use and has become very, very common in adolescents, because they want to experiment with new things, they want to try new things, but they do not know the harmful effects. Smoking is another um, uh, bad effect which adolescent has. They start taking cigarettes and other forms of tobacco, including cigars, pipe tobacco, snuff, and chewing tobacco, which contains the addictive drug nicotine. And upon entering the bloodstream, nicotine stimulates the adrenal glands, and adrenaline hormone is secreted, which stimulates our central nervous system. And they feel better, they feel relaxed. However, this has very, very bad effect if they and it can lead to long-term brain damage. Eating disorders are very common in growing adolescents. The three main types of eating disorders are anorexia, that is refusal to eat adequate food out of becoming fat. It can damage major organs. It can cause low BP. The pulse rate comes down. The body temperature comes down. There is problem in the menstrual cycle. The adolescent might become infertile. There are brittle hair and nails, and the bones become thin. It is fatal in about 1 out of every 10 cases. It can lead to even cardiac arrest and electrolyte imbalance. The second more common eating disorder is bulimia, which means gross overeating, or we call it binging, and then getting rid of or vomiting off, that is purging. The adolescent eats more, that is binging, and then gets rid of the food, that is purging, because he or she feels disgusted and ashamed after eating so much. They want to prevent weight gain by inducing what vomitings or by taking laxatives, some diet pills, diuretics, or even going out for anemias. But in this way, they cause damage to their esophagus, salivary glands, their blood pressure lowers, and it causes serious digestive problems. Binge eating disorder is a condition in which a person may gorge rapidly on food, but he does not vomit out, does not purge. The excess weight caused by this put the individual at a risk of heart disease, high BP, type 2 diabetes, and high cholesterol, and they are more likely to be bullied much more than normal weight peers. And studies told us, or a study declared that 10% of normal weight adolescents report being bullied as compared to 15% of overweight and 23% of obese children. And majority of these obese teens are likely to be excluded from group activities because they are not able to do it. So long-term treatments, which includes antidepressant medication, psychotherapy, support groups, can help in removing these eating disorders, these lifestyle disorders, and can renew physical, mental, social, and emotional health, or the holistic health of adolescents. Now, adolescent obesity, which I was discovering in the slide before this, is obesity in adolescents can be attributed to maximum because of their poor eating habits, more eating of fast foods, overeating or binging. There is lack of exercise, family history of obesity, medical illness, some medications they might be taking, stressful life events, peer problems, low self esteem, depression, and emotional problems. And they are more at risk, as I said, for problems such as heart disease, type 2 diabetes, and several types of cancer and bone problems, that is osteoarthritis. Now, teen depression is very, very common, and it is a serious medical problem when a person or the adolescent feels sad and loses interest in all activities. It affects how the adolescent thinks, feels, and behaves, and it can cause emotional, functional, and physical problems. Depression is a type of mood disorder. However, it can be treated with proper medication and counseling and positive thinking. The adolescents are very, very conscious about their appearance might include their clothing fashions or their accessories or hairstyles, nail art, body art, cosmetics, the shoe styles, and skin tones, etc. A very good initiative was taken by the Ministry of by MHRD, that on 9th April 2020, a working group was set up by MHRD to monitor and promote mental health and well-being of the students, not only to monitor and promote, but also to provide them psychosocial support in the form of counseling. Ex- Experts from field of counseling education, mental health, child and adolescent psychology, they are members of this working group, and while consultations and meetings are held with all of them time and again. So need of the hour is to prevent the problem in adolescents. The problems can be prevented if we give them health education, we give them skill based education, we teach them life skill education, we teach them family life education, we teach them the importance of family, the importance of fear, we give them nutritional counseling, we counsel them for emotional stress, and if we observe that there is some behavioral problem, we are able to diagnose it and we are able to manage it. To give more importance, Bulbul, to give more importance. Just a minute, sir. Can you hear me? Can you hear me, please?
Yes, ma'am, you're audible.
Suddenly, there is a problem in the battery. Just give me 2 minutes to plug in. Sorry for the botheration. Just give me 2 minutes. To give importance to the teenagers, special days are celebrated to give them importance. Like Teenage Day is celebrated on 31st July every year, and we celebrate a Teenage Week that is from 25th to 31st July, in which several competitions are organized by the government, by NGOs, by schools, by colleges, be it be a cooking competition or some race or some poster making competition or story writing, just to show the adolescents that they are very, very important to us. The adolescent period is very hazardous for adolescent health because they don't have proper guidance and counseling. And here comes the crucial role of the family. They have to shape the adolescent's behavior. They have to ensure them. They have to secure them. They have to support them. And family members in the community are to be informed and educated if any adolescent is suffering from any medical problem. A positive and encouraging attitude has to be developed among the family members and parents if we want our adolescent to grow properly, physically, mentally, emotionally, and socially. School teachers should also be trained on adolescent health, and community leaders play a vital role on adolescent health. Now, nutrition is very, very important because adolescents must eat properly for optimum health. They must go in for fruits and vegetables. They must vary the vegetables, take a variety, focus more on greens. They must focus more on fruits. If they like grains, they must go in for whole grains. Milk and milk products should be taken because they should take a calcium rich diet, but they should go slightly slow on meat and beans. They should go slightly lean with non-veg because it is, of course, very rich in proteins, but there are good vegetarian sources of proteins also. Now, year 2023 was declared as the International Year of Millets by the United Kingdom. So, millets must be included in the diet of adolescents. As adults, we have been eating millets since ages, but it is difficult to introduce millets in the diet of adolescents because they are not aware of the benefits of millets. Poshan Abhiyan, as was started by the Prime Minister, it says Sahi Poshan to Desh Roshan. If we give proper nutrition to our children, to our adolescents, who are the future citizens of our country, who are the future workers of our country will prosper. Poshan Ma 2023, it was celebrated, or the National Nutrition Month, with the slogan or the theme Suposhit Bharat, which means a nutrition rich India, Sakshar Bharat, which means educated India, and Sashakt Bharat, which means empowered India. So this theme underscores the interplay between nutrition, education, and empowerment in the country's development. So we have to ensure that our adolescents get proper nutrition, they are properly educated, they are empowered. Only then they will have proper physical, mental, social, and emotional health. The benefits of millets must be explained to the adolescents so they accept them in their diet and can improve their physical and mental health. There are several health benefits of nutri cereals or the millets. It is said that for if you want to have good life, if you want to have healthy life, you must take millets. You must eat right, and millets are very, very beneficial in detoxifying your body. It lowers the bad cholesterol level. It prevents the onset of breast cancer. Helps to prevent type 2 diabetes. Very, very effective in reducing blood pressure. Protects against heart diseases, helps in treating respiratory conditions like asthma, helps to reduce ulcers, colon cancers, excess gas, bloating and cramping. And the common millets or nutri cereals are bajra, jwar, ragi, kangni, which should be included in the daily diet of adolescents if we want them to be physically fit. Now, adolescents need the support of parents, their siblings, relatives, friends, family friends, teachers, their coaches, healthcare providers, religious leaders, traditional leaders, musicians, film stars, sport figures, which are model role models for them, politicians, journalists, bureaucrats, which form a part of the community. If we want them to remain healthy and going for holistic health. So multiple level of influences are there on the adolescent behavior. Now adolescent behavior is affected by 5 levels, that is the intrapersonal level, the interpersonal, the institutional level, the community level, and the society and policy. Now intrapersonal individual level influences on adolescent behavior are the individual attitudes, their beliefs, their knowledge, and development influences. The interpersonal includes the role of family, the peer group, and their relationships with other members of opposite sex or romantic relationships. The institutional influences include school and healthcare institutions, which are very, very important for holistic health. The community level influences include the neighborhood characteristics, community resources, and the norms. And the society and policy influences include the cultural, the policies, and medias. So all these together influence the adolescent behavior, that is intrapersonal, interpersonal, institutional, community, society, and policy, and each one has a specific and very important role to play in the holistic health of the adolescents. We should use multiple interventions to reach adolescents. Remember, healthy choice is the easy choice. So, one should implement multiple interventions in order to solve the problems the adolescents are suffering from, in order to make them physically fit, mentally fit, socially communicative, and they should be emotionally balanced. Schools are an ideal place to influence most of the individuals because it is easy to teach adolescents about health in schools, as we connect with most adolescents in school. And always remember, healthier students are better learners. Schools can impact the adolescent health by creating a healthy environment, by teaching them health education, by teaching them physical education, by teaching them importance of yoga, importance of meditation, importance of breathing exercise, and also provides health services where and when required. Health education and physical education should be provided to remain healthy. It can be a simple exercise or every day a routine should be followed so that they are physically healthy by walking, by doing exercise, by gymming, or whatever interests them and for whatever they can spare time. School health services is the need of the hour because this brings confidence in the adolescents that if they have any problems, the school will provide them with support. The general principles of a youth friendly healthcare center should be 5 A's. Now these 5 A's are that the youth friendly healthcare center should be available. The appointment wait time should be reasonable, not months and years. It should be appropriate, and the care or the attention should be given according to the needs of the adolescents. As we discussed earlier, that the need of one adolescent or the requirement of one adolescent differs from that of another. It should be accessible. The transportation should be available, and one should be easy. It should be easy to reach. The healthcare center should be easy to reach by way of transportation. It should be approachable. The center and staff should welcome the adolescents and not uh, treat them as a burden. They should accept, they should be non judgmental, and staff should show respect and care to the adolescents. Only then the youth friendly healthcare clinics can really care for if they are available 24 into 7, if they are appropriate, if they are accessible, if they are approachable, and if they accept the adolescent as he is or as she is. Adolescents have the right to confidentiality. Confidentiality means that the information which is told to someone, whether a counselor or a healthcare worker, should not be shared with others. Others means the parents, school, or third parties. It's private. This should be conveyed to them. Information which is disclosed to a healthcare provider is covered by confidentiality. Talking with your healthcare provider is considered very, very private, and the information which is required to be disclosed has limits on how much and when it is to be disclosed to a third party. There is a strong linkage between education and health, physical, mental, social, and emotional. And as we discussed earlier, schools and colleges have become places for promoting physical health and mental well-being. And the reports by ICMR, WHO report, and by the National Communicable Disease Council, they support this fact that mental health counseling is required. ICMR shows that 10 to 13% of children and adolescents in India, they are dealing with mental health concerns. WHO also supports that around 56 million individuals worldwide are treated for depressive disorders, which might increase which might have increased after COVID-19 pandemic. The National Communicable Disease data also says that every hour one student dies by suicide in India, which is a very alarming data. So the requirement is that there should be counselor in schools and colleges. In schools, the CBSE affiliation bylaws, they mandate or make it compulsory that there should be a counselor in every school, which are very, very important in residential schools and in colleges. And as per UGC guidelines, all higher education institutions have a counselor and a student counseling system where they can get their queries or their problems solved. So the need of the hour is to bring together the jigsaw pieces to improve the adolescent health care, to enhance the provider capacity, to ensure the adolescents that their information will be kept private, to take their consent, to incorporate health promotion, disease prevention, and youth development, to coordinate the services, and to engage young people, give them confidence that yes, their problems will be solved. This can really improve the health of an adolescent. Now, adolescence means preparing for lifelong health and wellness, that is physical, mental, social, and emotional health. And parents can help adolescents prepare for long life, health, and wellness. Healthcare providers can help adolescents prepare for lifelong health and wellness. Schools can help adolescents prepare for lifelong health and wellness. And together, we can help adolescents prepare for lifelong health and wellness. And here I would like to add a few lines that if we really want our adolescents, and of course, these adolescents are future adults, if we really want them to be healthy, we should remember two things. Number one is learn to accept the situation as it comes. See, a situation, if you are able to change the situation, change it. But if you are not able to change the situation, we must tell the adolescents to accept it and be happy. This will reduce their stress and improve their health. And secondly, they should learn to appreciate, they should learn to thank, they should have the feeling of gratitude, they should have love and appreciation for all, and they should try to live in the present situation, not think about the past and not aim for the future. Living happily, appreciating the present situation, having a positive thinking, having good lifestyle, and avoiding all lifestyle diseases by doing proper exercise, going in for yoga, and by taking a proper nutritious diet, they can have physical, mental, social, and emotionally health, and can fight off any situation what arises. The need of the hour is They must feel confident that they can do it, and together we can help them get that get that feeling of confidence and prepare them for lifelong health and wellness. Thank you so much.
Yeah. Thank you, ma'am. It was a fantabulous session. We thoroughly enjoyed. Yeah, friends, you can interact with ma'am. You can unmute yourself and you can interact with ma'am. Yeah, Neelam.
Yes, ma'am. Thank you, ma'am. Uh, Ma'am, uh, I just want to ask, as mentioned, this is a very good session for everyone, at least for me, I know. So the thing is, these things are they introduced in the schools and colleges? May I know?
Yes, ma'am, they are there in this. I am not a part of the school. I was teaching in a college, and we had a full-time 24 into 7 counselor was there in the college premises as well as in the hostel. And the phone number of the members of the department, the faculty of psychology, because they are more into counseling, their numbers were shared with the students and were also displayed on the display boards in the college.
Yes, ma'am. That is good. I'm
And
happy.
CBSE and UGC are very strict about these, especially after COVID-19. Every school and every college must have a counselor because there is nothing more important than the health of the student.
Yes, yes, ma'am. In North India, I belong to Chandigarh. I'm
Yes,
here.
ma'am.
I'm a social worker as well as a counselor. That is
Yes, ma'am.
hobby, I can say. And ma'am, whatever I found, no doubt about that, there are counselors. Before COVID, I saw counselors were given classes also. So they used to tell me this. I used to ask them, why is it that it is in the timetable, school timetable, 11th and 12th classes? Government of India are very happy that they have started this counseling services.
Yes, ma'am.
So they were telling our principal tells us that you have to take this class, that class, daily timetable is given to us. I said, she has asked you to take that class. Why can't you talk, do your duty, your job? That's good. You are given a class. That
Yes,
is opportunity to you that you can counsel students. And this was a news for me that counselors have been there, and this is going to be very good. And when being a principal, as you are told, that that thing is very nice. If this thing happens, then I think our adolescents won't do such things which they are not doing
definitely.
physically,
Definitely.
mentally, emotionally.
Yes,
Also, is they are disturbed sometimes. They don't know. This is how we started that because we found this report that students are going to secretly with their boyfriends for to abortion to doctors for abortion and all that. Then
yes,
then naturally the government, if it has become conscious about this and
yes,
starts doing in the large scale as you have told us, informed us, so that would be very good for the country as well as for parents as well as for children.
definitely, ma'am. Definitely.
Yes, ma'am. Thank you very much for such a
Most welcome, ma'am. Most welcome.
Thank you, Neelam.
welcome, ma'am.
Yeah, Jyoti ma'am, are you there?
Yeah, good evening. Good evening, Alushu. I was just listening to her.
Hi,
It's a
Jyoti,
wonderful
ma'am.
topic, ma'am, actually. Need of the hour. So, right now, I think everybody is talking about adolescence. And the points which you raised is actually absolutely right about the eating disorders and other things. Uh, but how much ever effort we put, still, I think the role of the parents is very, very, very crucial because the way they handle makes a lot of difference.
Definitely, ma'am. But ma'am, sometimes the children don't open up with the parents. It
True.
varies
Yes.
from it varies from family to family. You see,
Mm,
some families they are joint families. They maybe the children are more open to their grandparents than to their parents, and sometimes they want to discuss with their parents, but both the parents are working and they don't have time.
exactly.
You can't blame the parents if they're
Mm,
out from 7 to 7. How much time they can give to to
true.
the
True.
children? But
True. True.
well, then economic condition also has to be managed by the financial condition has to be managed by the parents. So the need of the hour is one must live in the present situation and not run too much after money. Well, living with less money, but in a better atmosphere with healthy children, I think is more important than living in a five-star bungalow with swimming pool and servants at my disposal and having no time for my children.
Yeah. Spending quality time is most
That is more
important.
important. Quantity is.
Yeah. Yeah.
मैम वर्किंग का तो क्वांटिटी टाइम हो ही नहीं सकता,
हो ही
but
नहीं सकता.
quality time should be. हाँ जी, that is more
It's a
important.
wonderful session, ma'am. I really,
Thank
almost all the points are apt and correct. And everybody should think about it. As I said, whoever is
Definitely, ma'am.
attending it, that they should think about it.
Definitely, ma'am.
Thank you very much
My
for
pleasure.
showing a
Yeah.
wonderful session.
Thank you, Jyoti ma'am.
Yeah. Thank you.
Yeah,
Dr.
Venugopal
Saab
sir.
hesitation. Aji, Dr. Venugopal ji.
Hi, Abaji.
I'm fine. sir.
Yeah.
I'm with my daughter these days in Gurgaon.
Okay. My observation-based comment.
Yes.
That is because I'm a person who observe. My skills are really good. That's what
Yes, sir. We know that.
only the politicians, they know how to raise their children. And look at the Lalu Prasad, the other, there is no conflict. They are able to keep the family together. Okay, the children again, they listen to their parents.
Definitely.
And so we must learn lessons from the politicians. That is my observation. I
Yes,
haven't
sir.
seen. That is it. Okay, there is no infighting. Domestic, they work as a team.
They
People
work as a
back.
team. Definitely,
Correct
sir.
me if I'm wrong. Correct me if
No,
I'm
no.
wrong.
Definitely,
That's
they work
right.
as a team.
So yeah, politicians, they don't go for all these counseling classes. They don't go and read about the how to raise the adolescents problems. Their children also go through the adolescence phase, and they are not being drug addicted. Their children are also not any of those things, and that is how they are the masters.
Definitely.
Okay, right. So Abaji, do a research and meet Lalu Prasad Yadav ji and other people and learn the secret or tips from them and share with us. Thank you.
Okay, sir.
Venugopal sir, you always comes with some different point of view.
Because I think differently. My hobby is thinking. Yodhiraja, my hobby is thinking. Every information I critically analyze and I look at it from different points. I'm not a
Yes.
theoretician. I have
Yes.
raised a son as a
Okay.
single parent. So what I know about the parenting, many
Yes.
people in the different forums, they talk only theory stuff. Some
Mm.
people, they aren't married, they don't have children, and they talk about parenting. That's a big joke. Okay, they don't know anything about this one, and they have become experts also, parenting experts, and they give many
But-
webinars. So
But
that is
taking Lalu
very-
Prasad ji as a case study is one of the best examples I can say.
Lalu Prasad.
Right.
Yeah,
Right.
it's really, yeah, really, that's true.
And look at that Sharad Pawar, his daughter, they are all getting along. And look at that the Mulayam Singh and his children, Akhilesh Yadav and all these things. What about Uddhav Thackeray and his son, Aditya Thackeray, and all this. That inheritance, dynasty, everything. They are together. But what about the doctors and other engineers? Their children, they are having conflicts. They are not even on talking terms and everything. So that is where we must learn. It is high time that we should not think that the politicians are stupid. They are not intelligent.
No.
We are very intelligent. We are
No.
very educated. No, we have some formal qualifications. We are
Yes.
not really street smart. They know how to. Practical life, they are the masters.
Yes, sir.
I did. That is when I raised my son. People are talking about internet addiction, this one, social media. I didn't get him a phone till he was 18 years old. Because many parents say, oh, no, these days children, it is very difficult. What is difficult?
Yes, sir.
I didn't get him a phone till he was 18 years old. And so that is what is doable. And my son is, now he's 31. When he was in USA also, no Pepsi, no Coke, no junk food. People say, no, it is very difficult. Because we should be a role models.
Yes.
But many parents, they are not role models. They preach, then they are hypocrisy. Then the children they won't listen to you.
They will not.
They won't follow you. No junk food, nothing. And take them to the mall, eating out, and instant gratification, whatever they want. When my son, when I used to take him out for the Walmart or checkout, there'll be some candies. The candies will cost only 50 cents or $1. And when he was 2 years old, when he used to put that one in this one, young, I said, no, not today. I'll get you later. It's not that I can't afford to. And when he wanted a small bicycle, he said, on your birthday. That is 2 months later. No instant gratification. The moment you give the instant gratification, there's no end to it.
Yes.
That is what many parents, grandparents are now competing with each other to buy the love. They're trying to buy the love. They visit them occasionally. They gave all the physical things, gifts, the candies, that one, whatever they ask. That is the problem. Okay.
Thank you, sir. Thank you so much.
Thank you, sir. Yeah,
Yesterday
friend.
I gave a talk on cross addictions. I'll be uploading that one. That one is everything about the practical, real life. I'm not a theoretician. I'm not a theorist. I don't like talking about theory. I talk about what can be done. And unless I have done that one in my own life, I don't even come and talk about it.
Talk about it.
That's it.
Yeah, you can share in groups. Others will be benefited. Yeah. Thank you,
And
doctor.
come on Thursdays from 8 to 9. You can come if you want to come.
Yeah.
If you don't want to come, you'll find excuse. You'll find excuse if you don't want to come. I know that one.
No
Yeah.
excuse.
Right.
Okay, sir.
Thank you, friends. Others, they can interact or we can conclude today's session. Yeah, Archana Vedantam, you want to interact with ma'am? Archana, are you there? No. Okay. Smita, thanks. Yeah, a lot of comments in chat box, ma'am, about today's session, positive comments. Yeah, thank you, friends. Thank you, Jyoti ma'am. Thank you, Neelam ji. Thank you, Venugopal sir, for active participation. We thank each and everyone in association with Yellow Pond and Forest Creative Arts, Sri Deepthi Counseling Center from Hyderabad, Clover Learning Center from Hyderabad, then Sirisha Counseling Center, Kozhikode, Mindstyle Hub from Kolkata. We thank each and everyone from our participants as well as from association group. Yeah, thank you, ma'am.
Sugandaji, I know one thing. Because I think differently, I speak differently, I call a spade a spade. Some people don't like me, and I don't care.
Pleasure to hear you, sir. And I'm definitely going. I will definitely include the example of Lalu Prasad Yadav in my presentation. I have another presentation on 3rd or 4th. I have to finalize that. So I will include that. That is also on adolescent health. I will include this, definitely, sir. It's a pleasure to talk to you, sir.
Yeah, we are looking more sessions from you, ma'am.
Okay.
Thank you so much.
Yeah.
Right.
Thank you.
Yeah, thank you, ma'am.
Thank you, Sunanda, for one more wonderful session.
Thank
Yeah.
you.